Hi, welcome to the July 2025 Therapeutic News. In the last couple of rapid therapeutic updates, we covered several pieces of new NICE guidelines and MHR alerts. This time I want to highlight a couple of guidelines which can support us with managing the complexity of multiple medications. As you know, there's ongoing concern about the number of hospital admissions associated with adverse drug reactions, up to 16.5% of admissions in one study. And also, you'll be aware the CMO report 2023 that highlighted that improving quality of life in older age sometimes means less medicines, not more. So this RCP toolkit aims to help us. It was designed for hospital. There's plenty in there for community care. And it includes key presentations and complications of polypharmacy. And there's also guidance on quality improvement measures and sustainability. So a long list of medicines can be challenging, but when we're talking about medicines related to hospital admissions, there are definitely recurring themes of higher risk medicines that we can look for. So, for example, here, proton pump inhibitors can be associated with low magnesium and low sodium. So the toolkit reminds us to think medicines. Could a medicine be contributing to the current presentation? So the document includes a table with common presentations with groups of medicines or individual medicines that may be implicated, and then some options or recommendations alongside that. In the May Therapeutics update, we looked at the NICE Falls guideline, including the advice to review medication, particularly centrally acting medicines. And when talking about treatments of patients, we're reminded to think about the brand questions from the Choosing Wisely campaign. So that's considering benefits, risks, alternatives, or do nothing. So the toolkit highlights guides for discussing risks and benefits. So for example, the GP evidence website and the Prescript impact tool. But how easy you can have this discussion with the patient. You can agree you want to consider tapering a medicine, but how do you do it? And for me, this is where the AWMSG polypharmacy guidance is particularly helpful. So section 6 has a practical guide to stopping medicines. So for example, for benzodiazepines, it gives tapering guide, it gives diazepam dose equivalence table, and advice on what symptoms the patient can expect. Other areas include stopping bisphosphonates, how best to reduce antacids, and then the really difficult medicines, centrally acting medicines, opioids, gabapentinoids, antipsychotics. So lots of really helpful guidance there. So the RCP toolkit contains a list of resources and calculators and gives tips on asking about medicines. There's also the advice to familiarise yourself with some of these tools and resources and agree with your team which are going to be most useful. So I'll just highlight here the MediCheck tool, which is one of the resources suggested. And that's very similar to the anticholinergic burden calculators. But here you can put in, you list your medicines, and it also advises on the risk of QTc prolongation, low sodium, bleeding, dizziness, drowsiness, or constipation. So that can be handy. Obviously, very similar advice to the BNF, but this is just a different way of accessing that information. So in summary, these guidelines help us to empower patients by, for example, using the brand, benefits, risks, alternatives, and doing nothing, shared decision making. Remind us to think medicines, whether a medicine could be contributing to the current symptoms. They remind us it's doable, especially if we look out for those common medicines and patterns of medicines. It's useful to look at some of these tools and resources and choose a couple that suit you or your team. And I do think the polypharmacy guide in older people gives really helpful pragmatic advice on specific medicines and how to optimise them. Thank you very much for listening.